Follow-up is changing. Macmillan has found that the traditional approach to follow-up is not particularly effective in detecting recurrence of cancer, and it doesn't suit everybody. More modern methods of follow-up may be required, and I'll go through this next. So why do we follow up patients? There can be a number of reasons given. It's lovely to see people who've been through a difficult time walk through the clinic door well with a smile on their face. But after the initial post-operative period, do you really need to come to clinic at all? The aims of follow-up are to detect recurrence. But recurrence is usually detected by using blood tests and CT scans, and so the outpatient appointment is not that useful in detecting recurrence. We follow up patients to provide support. Yes, that's a good idea, particularly in identifying problems and dealing with them in a face-to-face manner. In addition, we provide follow-up to audit our surgical results so that we can improve our outcomes for patients and provide better care for you and patients in the future. The traditional old-fashioned approach to follow-up after bowel surgery was to bring patients back to a surgical clinic, to a hospital on a certain day, to come into a surgical clinic to see their surgeon. At that clinic appointment, after the patient waits for a number of hours, you're ushered into a room, you get examined, and we organise some blood tests. We then order some tests, including CT scans, which come back after the appointment. Research has shown that a lower clinic appointment can perform a useful function, such as reassurance and assessment of any problems. It's not very effective at picking up recurrence of cancer. And furthermore, some people report that going to the hospital appointment can be stressful in itself. With advice from our patient group, we at Wythenshawe are moving away from the traditional approach to follow-up to a more modern approach where you will be directed to a nurse-led follow-up appointment. The advantages are that this colorectal nurse specialist has more time and are more experienced at identifying problems and addressing these issues. The specialist nurse will do an assessment called a holistic needs assessment to identify specific needs for each individual. However, some people do not want to come to a clinic at all. And in general, as recurrent disease is picked up not through clinics, but through blood tests and CT scans, we're moving on to a new form of follow-up, which is called patient-directed follow-up or supported self-management. In this scenario, patients are initially seen by a consultant in the post-operative period in their surgical clinic and are moved into the nurse-led clinic. And once recovery is underway and no further concerns are identified, an individual may elect to be followed up remotely with blood tests and CT scans only and not come to the hospital at all. Clearly, if a patient is in supported self-management follow-up and if they develop any further problems, they can contact the nurse or doctor to be seen in one of their clinics if required. In general, follow-up aims to detect recurrence of disease and takes the form of regular blood tests, CT scans and colonoscopies. The interval between blood tests, scans and scopes can vary, but generally the tests are done frequently at the beginning of the follow-up period and become less frequent as you go through follow-up. The blood tests look for anemia and also check a tumour marker called the CEA, which can sometimes indicate that the cancer is recurring. The CEA blood test is not always 100% specific or sensitive, but it can help in detecting many of the recurrences before they develop symptoms. The CT scan looks for any recurrence of disease anywhere in the body, particularly looking at the lungs and the liver. If a cancer recurs, it is possible that further surgery may be offered to remove that recurrence. A colonoscopy is an endoscopy test that looks at the remainder of the bowel, with view to detecting any further polyps and removing them, or identifying any new tumours in the bowel. Colonoscopies are performed usually at a year after surgery and then at 4 years after surgery. If at 4 years there are no further polyps or disease, then further colonoscopies are usually not required. Cancer doesn't just affect the person with cancer. Cancer affects all those around that person, so relatives, partners, carers, friends and colleagues. A carer is defined as someone who provides unpaid support to a family member or friend with cancer who wouldn't be able to manage without their help. Carers are crucial, and as a carer, you often feel you have to be strong to help your relative or friend. This can be exhausting and draining, and carers have their own concerns and needs too. There is lots of support and information available for carers, and the Colorectal Nurse Specialist and Macmillan Health Centre and Macmillan Advice provides information and booklets which are a great resource.